Talk more about International Overdose Awareness Day. We are joined by Dr. Craig Allen, Vice President of Addiction Services at Hartford Healthcare's Behavioral Health Network.
Dr. Allen, thanks for joining us.
Thanks for having me on.
Well, first off, so many people at home have been impacted by this opioid crisis, especially in the last 10 years, even in Connecticut. And there still is a stigma surrounding substance abuse and recovery and getting help. What are some of the biggest stigmas surrounding this category in this field?
Well, the important thing to understand is that having a substance use disorder is having a chronic and recurring disease or illness like other chronic occurring diseases and illnesses. So like chronic obstructive pulmonary disease, diabetes, and so forth. You can try and prevent it. It's important to identify it early and important to intervene. But because substance use disorders, addictions present with behavioral symptoms and impact the way people think, it's hard sometimes for people to wrap their heads around that, and they look at it more as a will or something people want to be doing as opposed to something that can get out of control.
Dr. Allen, what role do you think the pandemic had on people suffering from addiction? We know this last year and a half has been incredibly stressful for people.
Yeah, people in the field say the opposite of addiction is connection, and quarantines and disruption of support services, recovery services, treatment services, and harm reduction programs is the opposite of what is needed for someone who's struggling with addiction. The anxiety and the fear and the concerns drive those kinds of urges to use substances, and the programs that are normally available to ward those things off weren't readily available. It took a long time to try to get things back on track.
If someone has a family member or themselves are dealing with an addiction, taking that first step could be daunting. What services are out there for people struggling with addiction right now?
There's in-person services, there's virtual services, there's inpatient, there's outpatient. The important thing is to use what's available out there, and FDA-approved medication for opioid use disorder is the gold standard. If someone's not ready for treatment, then the important thing to do is prevent harm, prevent someone from dying. So naloxone, the opioid overdose prevention medication, it needs to be out there and everywhere. And trying to connect with people where they're at and keep them alive till they're ready for treatment is incredibly important.
So true. Dr. Allen, thank you so much for your time and your expertise.
Thank you very much.
Moving along here on the news at 4.